When your patient is throwing up, you don't have time to guess. You need the right tool and you need it now. So I want you to think of antiemetics as your own clinical toolbox. In this explainer, we are going to master every single one of them, so you're always ready to go. Let's get right into it.
Okay, picture this. You're on the floor and your post-op patient suddenly starts vomiting. They're in distress, they're looking at you. What do? Knowing exactly which tool to grab from that antiemetic toolbox isn't just a test question. It is what makes a safe, confident nurse. So here's our game plan. We're going to quickly break down why nausea even happens. We'll look at the specific drugs that stop it. And then, most importantly, we will lock in the critical safety alerts you absolutely cannot afford to miss. Let's dive in. First up, let's understand the challenge we're facing. You gotta remember, nausea isn't just some simple symptom. It's actually a pretty complex response. And just throwing the wrong drug at it can be, well, useless or even dangerous. We have to be clinical detectives here and figure out the cause first.
And believe me, the causes are all over the place. We see it in our post-op patients, like in that first scenario. It's a huge side effect of chemotherapy. So many women experience it during pregnancy. And of course, there's just good old-fashioned motion sickness. Each one of these might need a totally different tool from our toolbox. So how does the body's nausea alarm actually get triggered? This is key, because to choose the right drug, you first have to understand the signal pathways. Just think of these as different wires, all leading to the same alarm bell in the brain.
For the NCLEX, you really just need to know these three main pathways. First, you've got your inner ear's vestibular system that's all about motion sickness. Second, an irritated GI tract. And third, this really critical area in the brain called the chemoreceptor trigger zone, or CTZ. Think of the CTZ as the body's toxin detector. Now, every single drug we're about to talk about, its whole job is to snip one of these specific wires.
All right, let's crack open that toolbox. We're about to break down the must-know antiemetics for your exams and, of course, for your clinical practice.
First tool up, scopolamine. This is an anticholinergic. Now remember that vestibular pathway we just mentioned for motion sickness? Well, scopolamine works by blocking the signals right there at the source, which makes it the go-to drug for that specific problem. So logically, it's perfect for motion sickness and some kinds of post-op nausea. You're going to use it cautiously in patients with glaucoma or urinary issues. Okay, and here it is, the #1 absolute must-know safety alert you will be tested on. The scopolamine patch has metal in it. It must be removed before an MRI or it can cause serious burns. This is a huge patient safety issue.
Okay, let's move to our next tool, prochlorperazine. This one is a dopamine antagonist. It works on a totally different wire. It targets and blocks dopamine receptors in that toxin detector part of the brain, the CTZ.
This makes it a great all-around general-purpose antiemetic. Now, besides making your patient sleepy, your top priority is this critical alert, the risk of extrapyramidal symptoms, or EPS. So what is EPS? To keep it simple, it's this group of really disturbing movement side effects. Think tremors, muscle stiffness, restlessness. If you see your patient developing these, that is a major red flag. Oh, and also, just give your patient a little heads up that their urine might turn reddish-brown. It's harmless, but it's definitely good for them to know.
All right, let's switch gears completely. Meet metoclopramide, which is a prokinetic. So instead of just blocking signals in the brain, this drug actually gets things moving. It increases gastric motility, physically pushing food out of the stomach and forward through the gut. This is amazing for something like gastroparesis, which is just delayed stomach emptying. But, and this is a big but, you absolutely do not use it if there's a GI obstruction. Think about it. You can't push against a roadblock. And boom, look at that. There it is again, that critical alert for EPS. Remember, that means watching for tremors, stiffness, and restlessness. Seriously, when you see metoclopramide or prochlorperazine on an exam, your brain needs to scream, watch for EPS.
And that brings us to one of the most powerful tools in the box, ondansetron, which you probably know as Zofran. This is a serotonin antagonist, and this thing is a superstar because it works on two pathways at the same time. It blocks serotonin signals coming from an irritated GI tract and at the CTZ in the brain.
This dual action makes it incredibly effective for nausea from chemo, surgery, and even pregnancy. But it comes with a life-threatening critical alert, QT prolongation. You see, on an EKG, the QT interval is the time it takes for your heart's ventricles to recharge between beats. This drug can stretch that time out to a dangerous length, leading to a deadly arrhythmia called Torsades de Pointes. That's why you have to monitor your cardiac patients so carefully. This is a massive, massive safety point. Okay, phew, let's put it all together. This next slide summarizes the absolute highest yield safety alerts you have got to know for the NCLEX and for safe practice. Let's really lock them in. Let's break this down. Are you seeing a pattern here? The two drugs that mess with dopamine, prochlorperazine and metoclopramide, they both carry that EPS risk. The one that hits serotonin on Dancitron, that's the one that needs cardiac monitoring. And the number one rule that applies to all of them? Always assess the cause of the nausea before you give the drug. Never ever forget that. All right, you have officially made it through the entire toolbox. Now let's do one final check to make sure all this knowledge is locked in so you can walk onto that floor with confidence. And really, this is what it all boils down to. It's not about just memorizing a long list of drugs. It's about understanding the why behind your choice, matching the right tool to the right job, and always performing the right safety checks. That right there is the core of being a safe, effective nurse. Look, the absolute best way to make sure this stuff sticks is to test yourself. Head on over to nursingwithcharity.com.ng right now and try out the NCLEX practice questions on antiemetics. It is the fastest way to get yourself ready for your exam. Thanks for watching, and keep up the great work.